again, Tonzia, for joining us. I really, really appreciate it.
Yeah, of course.
Yeah, so I just have a little introduction I'm going to read for you. Thanks to all of you for joining us for our ENVEST event with our guest Tonzia Buor. We want to start our program with an acknowledgement of Indigenous land. The University of Colorado Anschutz is situated on the traditional territories and ancestral homelands of the Cheyenne and Arapaho nations. This was also the site of trade, hunting, gathering, and healing for many other Native American nations, the Ute, Lakota, Kiowa, Comanche, Apache, Shoshone, and many other Native nations. We acknowledge this land's significance for the indigenous peoples who lived and continue to live upon it, people whose practices and spiritualities are tied to the land and continue to develop in relationship to the territory and its inhabitants today. This event is brought to all of us by Future Voices, Students for Diversity, Equity, and Inclusion. Future Voices is a student-led organization at the University of Colorado Anschutz College of Nursing. We're committed to fostering a space for students to collectively create a more diverse, equitable, and inclusive nursing community within the college and beyond. Our wonderful speaker today is Tonzia Buor. Tonzia's expertise ranges across leadership development, colleague engagement strategies, and developing and refining HR policies and practices. Her industry experience encompasses healthcare and nonprofits. In addition to her tenure as Vice President at North SuburbanMedical Center, Tonzia has worked at Swedish Medical Center as an Assistant Director of HR, and before that served as a Staffing Coordinator, Recruiter, and HR Generalist for a large healthcare system in Indianapolis, Indiana. Tonzia received an MBA degree from Anderson University in Anderson, Indiana, and earned a BA degree in Political Science from Hope College in Holland, Michigan. Originally from Liberia, West Africa, Tonzia is a board member of her family's nonprofit organization, Christian Leadership Training International, that's currently building a college prep school in Liberia set to open in September of 2021, which is really awesome. Tonzia is also involved in providing hospitals and clinics in Liberia with basic equipment and resources. So Tonzia, thank you so much for joining us. We're excited to have you here.
Thank you. So if it is okay, I would like to start off by, since we are a small group, which I love, that means you all will get to talk to me throughout this presentation. You didn't know you'd be presenting as well. So if you could all just introduce yourself and just tell me what you're studying, your background, kind of interest in healthcare, you know, just relevant information so I can get to know each one of you a little.
Yeah, I can start since I've already been talking so much. My name is Gabby. I use she, her pronouns. I'm just about to graduate, and my kind of clinical interest is my long-term goal is I really want to work in community health. But for the first couple of years after graduate, these next couple of years, I think I try and want to do some kind of inpatient work just to get the experience under my belt. And I also really need to perfect my Spanish, which is lacking right now.
So you are nursing? Is that
Yeah,
right? Okay.
That's correct.
Okay.
I think all of us are nurses.
Everybody is? Oh, okay, perfect. That helps.
I can go next. I'm Sarah. I am a family nurse practitioner student. My background as a nurse is in pediatrics and public and community health. So did some women's health and immunizations and CDC surveillance. So planning to go into family to kind of have a full scope practice and particularly love my adolescent patients.
Nice.
I'll go next. I'm Lauren, and I am also graduating in May with my BSN.
Okay.
I don't have any history of medical employment, but I am excited to get started and hoping to work in the NICU with the little tiny babies at UC Health.
Yes, love the NICU. I'll have to tell you my NICU story.
Yes, please.
Hello, my name is Ferdinand. Hi.
Hi, Ferdinand.
Hi, I'm an FNP, I'm a nurse practitioner student as well at CU, and I'm graduating in May. My background is in, mainly geriatric and med surg. That's what I like to do. Yeah.
Perfect. Well,
Thank you for coming here to share with us.
Yes, thank you.
I can go next, but I'm going to leave my camera off because my internet is a little unstable. But my name is Omara, and I am also a nursing student. I'll be graduating in May. I want to work with the pediatric population with a holistic, equitable, and inclusive lens. And I think eventually I want to do something in public or community health.
Great.
Gabby, oh, sorry.
No, you're right on. I was like, I think another Gabby.
Yeah, Gabby S. We're just going around introducing ourselves and talking about where we're at with school and kind of what our interests are. If you care to share, but you don't have to.
And maybe you can share later if you would like as well as we kind of talk. Can everybody hear me okay? Okay, so before we kind of dive into healthcare and it being inclusive, I'll give you a little bit more background so I think you understand where I'm coming from. But like Gabby nicely stated, I'm originally from Liberia. I've lived in the US since I was 10. And actually, and I will give my age away. So I am 36 and had the chance. So I left Liberia when I was 3 years old. And my family lived in Kenya and the Gambia as well. My dad is a pastor by trade, so we did some work with the Muslim communities in those two states, or two countries, sorry, and then moved to the U.S. when I was 10. My family has mainly been focused in resettlement work for Liberian refugees. So Liberia had a civil war for a very long time. Actually have two, so you want to count them separately. But is most well known, or maybe not known, as America's unofficial colony. So if you look at the Liberian flag, it looks like the U.S. flag except one star. And then the capital is Monrovia, named after James Monroe. You see plantation-style houses and stuff because that is what the Americo-Liberians knew when they did the Back to Africa movement back in the 1820s. We have counties like Maryland and Buchanan, and a lot of the Americo-Liberians had slave master last names. So you'll meet a Liberian like myself who's indigenous and last name is Buor, and you'll meet one whose last name is Johnson. And we're both Liberian, but just different kind of lineage there and stuff. So very interesting little country. But Civil War occurred for a long time. A lot of Liberians were resettling in the U.S. So my family realized that as refugees arrived, there weren't a lot of organizations in place to help them settle. So they didn't know how to apply for apartments or how to learn how to drive, get driver's licenses, apply for jobs. So the basic things. So that's really what we spend time doing is we would house some refugees and then help them get some of those things and then move them out. So always been doing that work. Decided to refocus in Liberia, and we built a Christian college through a nonprofit organization that opened in 2009, and then have been working on a college prep high school that opens this year. So I got to return to Liberia for the first time in 2019 since I was 3, which is craziness, but also the best experience ever. So because a lot of people are like, what do you think? And I was like, well, I have nothing to compare it to because I don't remember anything from when I was 3. So everything was great. Like I got to eat Liberian food all day, every day because I can't cook it. So I was like in heaven when I was in Liberia. But part of my passion in healthcare, I actually went to nursing school for a couple of years, and I'm a nursing school dropout. You can talk about me. But it was really hard, and I was like, this is too hard. I want to quit. So I got an MBA in stats because when you write 40-page papers, people think you're really smart. And then you get A's on everything. I mean, it's like the most like uplifting degree out there. So I did an MBA in stats, but I do have a brother and sister who are both nurses. So we definitely have a passion for healthcare in my family and making sure that folks have access to resources. So that started my work in Liberia getting supplies and shipping them back to clinics. There were clinics that were reusing gloves, so they would wash them, hang them up, and then use them again because you didn't have an endless supply. So started buying gloves, different things, sending them back there and supporting different hospitals as well as nursing students there. So nursing students pay about $500–600 a year in tuition and cannot afford it, which is crazy, right? Like you think like, I wish my tuition was $600 a year, but really couldn't, you know, and stuff when you're in a country that, you know, lives on $1 a day and things like that. So started supporting a lot of students and so on. So all of that work is going on. At the same time, I'm here in the US, do my MBA, get into HR, because I realized that even though the bedside was not for me, I still wanted to make sure that I remove barriers in the workplace so those that are at the bedside or doing other healthcare work can focus on our patients and on our communities. So that's a big passion of mine. But the more I've gone into healthcare and the more I've been in HR in healthcare, I've realized that there is a lot of work to be done around diversity, equity, and inclusion. And it starts with the people first and then translates into care. So if you do not have a workforce that understands what inclusive healthcare is and why diversity, equity, and inclusion are important in that space, your patients will never get that benefit. So in HR over the years, that has become a focus of mine of how do we make sure that we recruit and retain talent that aligns with that kind of mission, right? So I was so happy when I was invited to kind of talk about this a little bit. And I want to make sure that, again, this is a dialogue, so please jump in and start lining up your questions. Hi, Sawa, how are you? But
Sorry,
just start lining up your questions. No, that's okay. I want to make sure that we just have dialogue. But the first things I want to talk about is just getting into healthcare, right? So you all are on here because you have some type of interest investment in ensuring that you are equipped in this space, right? As you go out and start taking care of patients, and I'm so glad you are, and being proactive about this. So getting into healthcare, first of all, is key, is making sure that not only are you getting jobs in spaces where you don't see diversity occurring, but that when you do, you become an advocate for it. So as employees in the workplace, it's asking the question, as you look on your unit, is why do we only have one nurse of color on this unit? It's why are all our physicians, you know, from this specific area or whatever else? It's starting to ask those questions. So that is key. First of all, going into healthcare that I want you to have in your minds is number one, as I interview for roles or as I look at going to spaces, I need to start asking the questions. You know, is what initiatives are you pursuing to ensure that you have DEI occurring in this facility, and how can I make sure I'm a part of it? So asking questions is key. So your interest is the first one. The second one is not passive interest, but active interest, right? Is making sure you are asking those questions, because it does get easy in healthcare, and I have had those moments too, where you get comfortable and you kind of give up, right? So I had one of those moments recently, and I, you know, as a woman of color, I have a lot of my examples maybe around that. So please push me if you want me to explore other examples, but I'm just speaking kind of from my experience. So you will hear that quite a bit. So that's my disclaimer. But I want to make sure I tell kind of, I really explain my experiences to you. So unfortunately, they might come across one-sided, but I think important that they can go across different groups as well. So one example was we've been hiring for several leadership positions. And after the first, I would say 5 or 6 interviews, I realized I was not asking the question of why didn't we have diversity? We had no male candidates and we had no candidates of color. And that's the comfort that I think sometimes you have to, that's why I say active interest, because sometimes you get so used to seeing one thing, right? You know, and nobody else has a problem with it and nobody else speaks up. So you just kind of get comfortable and get passive. So I realized after it took 6 interviews for me to go, Tonzia, you haven't even asked them, you know, why are there no male candidates being presented? And why are there no candidates of color? And I'm kicking myself like, this is what I'm passionate about though. Like, why am I getting comfortable? So it's very important to really be actively interested in this and asking the questions and challenging yourself and others to do what is needed to create this inclusive workforce. So I think the workforce is one piece. The second piece is in creating that workforce, it's creating programs that specifically address the gaps in healthcare. You know, so for example, it's creating residency programs in collaboration with HBCUs or different organizations. So I work at North SuburbanMedical Center, which is owned as part of Health One, which is like Rose Medical Center, Swedish, Skyridge, if you've heard of those facilities, and then is owned by HCA Healthcare, which is a national organization, for-profit organization. So largest network of hospitals in the US, but it's being intentional because in our division, I'm the only HR vice president of color in our entire division. And this is 8 hospitals. This is folks who oversee 14,000 employees and stuff. So that's very telling that we have some gaps, right? So it's making sure that HCA's DEI focuses and initiatives are on building pipelines that feed into that. So if we say we're interested, how are we creating the pipelines and doing the actual work to meet that? Because talk is cheap at this time when our patients are being affected by the lack of interest or the lack of active interest in DEI, and making sure that we're inclusive in the way we provide healthcare and support the workforce. So creating programs and initiatives to ensure that we're meeting the goals that we talk about, and we have to make sure it's not just talk. So as we transition into the workplace, couple of things I want to bring to mind. So the first thing is making sure that we are familiar with cultural norms in healthcare across different groups, right? So that sounds very general, but what I mean by that is, as you transition to care or as you have been given care is, are you aware of what cultural norm you might have to be aware of taking care of a Hispanic patient? So one of the key things with the Hispanic culture is the focus on family, right? So as a nurse, as you walk into a room, there's a Hispanic patient there, and you may get annoyed because there's 15 family members in the room. And you're going, oh my gosh, I just want to do my job. Like, I need to start my IV, I need to do this, and all these people are in the way and stuff. But not realizing that that is so important because family is at the forefront for that culture. So acknowledgement of that cultural norm would be walking into the room and greeting the family. So it's greeting the patient, greeting the family, and saying, I'm so glad you're here to support during this difficult time. If you have any questions for me, I want to be more than happy to take time to answer your questions. So not only do you show that you're there for the patient, but you're respecting the family as well, because that's key. And that also happens with Black patients and family members as well. You know, I experienced that when my sister was hospitalized and I was in the room, and the provider never looked at me once and never spoke to me. And I was in shock because I was like, but why wouldn't you? You know, like, family's supposed to be here and I'm here and you don't acknowledge me and you don't speak to me. And after the provider left, I turned to my sister, I was like, do you even feel like you're getting good care? This person didn't even talk to me. So then it became about the care that this person was given, regardless of what degrees they had and regardless of what experience they had. You know, so as a nurse, as a practitioner, as you walk into those rooms, it's please making sure that you educate yourself about some of these norms, because that is a way to drive care as well. So imagine going in, again, back to that Hispanic patient, focusing not only on the patient but on the family, so that when you say discharge instructions are, you would be surprised at the level of engagement you will get from those family members to ensure that that is carried on. And that is truly how you engage and take care of the health of your communities, right? Because if you had never acknowledged the family, you talked to the patient and said, I need you to do this when you leave. Well, guess what? They live with the 5 family members that you ignored the entire time, who now are not going to engage in that care that you know is what is needed to make sure that person stays out of the hospital or does what they need to do. So are you all kind of seeing the connections there of, you know, cultural norm, knowledge, and how that applies in the healthcare setting, and then how that can affect kind of the work that is needing to be done once they are discharged or not there any longer? Any questions about that? Let me stop for a second. I'm talking quite a bit, but any questions about kind of moving into the workforce with this active interest in what that looks like, as well as initial interactions with patients and how we use our knowledge to drive compliance? I'm sure someone has a question.
Something on that topic, just based on, I think, patient interactions I've had and like those cultural components especially. I guess my question to you on that is it, sorry, there's a dog behind me making a weird snoring noise, in case you're wondering what that is. I'm curious if it's best to approach a patient family and kind of ask them, or to do research ahead. I guess what's kind of a better approach within that, if it's disrespectful to them trying to engage in that way as opposed to already trying to set the tone?
Yeah, no, that's a great question. I think both, right? It's a combination. I don't want you to feel pressured that you have to learn about every single cultural norm on earth, because that's a lot, right? So I think there is some intentional learning that you need to do, especially as you look at the communities you will be working in. So maybe that's key, is what communities am I going to be working in? For example, we are up here in Thornton. Thornton is a very interesting community. So a lot of growth happening, a lot of people moving from Denver to get cheaper housing. They're doing a lot of new builds. They've built up like Northfield shops. And then there's some other mall stuff going on here. So, you know, really making it nice. But Thornton also struggles with some drug issues, right? So we see a lot of drug use, and this is where my NICU story comes in, is unfortunately a large population of our babies in our NICU have come from mothers who were on drugs while taking care of them or while carrying them. So by the time they are born, you know, we're working on weaning them and doing all those things as they're going through withdrawals. And this was my first real encounter with that. And it's been very interesting to learn about the work that nursing staff and the nurse practitioners that work in the space are doing. And my only fun, and you're like, where's the fun part in that story, Tonzia, right? So the fun part in that story is, since we've gone to WebEx meetings, some of the babies, as they're coming through withdrawals and being weaned, they cry a lot, don't sleep, and have to be held constantly. I take my WebEx meetings from the NICU because the nurses need just a break. In all reality, they need a break, and they need to step away, and they need to do other things. And I will come up and say, hey, I'm on this WebEx for an hour where I don't have to talk. I just have to be present. And I'm like, this baby doesn't mind me being on speaker and hearing some boring conversation. So I will just sit up there, and I get to hold these babies for an hour or longer. Like, and then I started intentionally moving meetings to WebEx to keep doing that. And then it became a problem because I'm sure somebody told on me. Snitches, no, I'm just kidding. But no, it has been fantastic to be able to do that. But so again, okay, back to the community. So the community, again, is folks from Denver moving up to Soren because they want to buy cheaper. You have this kind of drug population. You have some few crime issues, right, and stuff like that. So we're dealing with gunshot wounds, and then you have this going on in the NICU and whatever else, and then you have a semi-large Hispanic population up here as well. So it's being able to be knowledgeable about the community that you live in. So for our staff, they do focus on Hispanic, you know, cultural norms and making sure, and then also with how do you address or have conversations with parents who look like they're 18. There's nothing wrong with being 18 and a parent, but having a baby in the NICU that is being weaned off drugs that they were on, and having those conversations and engaging and, you know, connecting to ensure that if this baby is going home with them, that they can continue the care that you want. So it is learning your community. So if you have a specific community, there's learning you can do up front. Other than that is, as you are in the environment, I think definitely asking. It'll take 2 seconds to walk into a room and say, and you can always greet everybody that's there, and you can turn to the patient and say, you know, can I include them in conversations about your care? And the patient might say, yes, please do, because I actually live with my daughter and her family, and, you know, that's who is in the room and things like that. So great question. It's a combination of both. But the work that you can definitely do up front is, if you know where you'll be working, learn your patient population, and then do the research to ensure that you're knowledgeable about how you can better serve them by understanding them. Great question.
And you bring up a really good point also of knowing how to support your nursing staff from your role. Having been a nurse at Children's and working with a number of those babies going through withdrawal who, like, they literally just need to be held. It's not even that, like, the rock, they just want that comfort. What a big thing that is, and just a small sentiment to make.
Yeah. What else? What other questions?
I have a question.
Yeah.
What advice can you give? This is just a hypothetical situation. If you are at a facility or a hospital that you work at and they're resistant to change and doing more work around DEI, obviously it's easier to leave, but then nothing will change. So what suggestions do you have in order to be more of an active agent for change when you are part of a resistant kind of system?
Yeah. Yeah, great question again. So I think there are a couple of things with that. You know, I think resistance sometimes comes, we need to distinguish or identify the source of the resistance. I think is key. And I have learned to be strategic, right? Because I realize sometimes my passion for DEI overwhelms people, that people are not at the same place as I am in my interest and my comfort in talking about DEI. You know, I'm very straightforward with, like, oh, did you mention microaggression? Let's talk about that, you know, kind of thing. And someone else, that is like the worst thing that happened to them that day. So I think number one is figuring out, like, what is the source of the resistance? Is it because the institution feels like if we acknowledge and if we start to change, we are acknowledging or admitting that we are doing wrong, you know? So that's been a key question, even at my facility and part of the executive team, that we challenge ourselves with, is if we are not making this change, is it because we're just afraid that people will think, like, well, they've been doing this wrong the whole time. You know, they've been discriminating and they've been racist, or they've been doing this. And that is why now they are now resistant to change, because they don't want people to think it's because they haven't been doing something, which, you know, like between me and you is kind of it. Like, that's why you do, you know, change or you evolve, is because you haven't been doing something. But sometimes people are not ready for that. So we need to figure out what is the root of it, right? And then what are the practical applications that we are offering up? So, you know, and again, it's being very strategic. You know, there are some organizations who are in a place where you can be very direct and kind of hit the nail on the head of like, this is what's needed. And there are others that you walk around it a little bit. So it is, what is the practical application of what needs to be changed? And do they know how to change? You know, that's another thing I faced, is that resistance to change is truly because they didn't know how to change. So then I had to bring solutions and say, hey, this is, you know, what I've observed. I think we could do this. And I am more than happy to lead that with your support. And I can tell you more about that, you know, situation, or how this change can be implemented, you know. So unfortunately, Omera, it becomes this very strategic game, but it really comes down to, we have to figure out what the source of it is, and then come up with strategies or action items on how to move kind of the needle a little bit, if that makes sense.
Yes, thank you so much.
And if you have more specifics, like you want to talk about somebody, we can do that too.
I do have one question.
Yeah.
Tonzia, what do you do if you feel that the actions of your superior, the person you report to, are indicative of some form of workplace discrimination, but in a very subtle form that they may not even realize?
Mm-hmm.
And their actions continue to make you feel lesser than, incompetent, subjugated, whatever the word you want to call it. What would your suggestion be? Like, you know, bringing it, should that person bring it up to them without fear of repercussion, or should they leave? Like, what are your suggestions as far as from an HR perspective?
Yeah. I guess one question is, do you feel like this individual is open to conversations and direct feedback? Like, just in general, so not even specifically about this issue, but in general, have you been able to have open conversations?
No, not really.
Okay. Yeah, no, that's good to know, because that's the first question you want to ask, right? Is, even if it's not about this, have I in the past been able to have open conversations, whether it's just been work related or something else? Because that's very telling, right, of what that, you know, what's happening in that relationship and that dynamic, you know. So, you know, from an HR perspective, I think, you know, conversations and communications are key to start creating change in situations. I'm never supportive of someone staying in a situation that is not healthy or beneficial to them, right? And that includes being in the workplace. So in this situation, I would say finding a third party to sit down and have a conversation with you. And that's where, and again, I'm not familiar with that setting, but where HR is very involved here, and where I drive a lot of change from. So it's sitting down with a leader and their employee and just giving an example of saying, I am here to support the both of you in this conversation that we need to have. And specifically, this may be a difficult conversation, but I want to ensure that we are transparent and we are honest, because again, whatever the goal is of why you're there. So in our setting is, we want to make sure that patients are at the forefront of everything that we do, And until we have this discussion, that may not be happening, and that is concerning. So right away, you have to disarm both parties, right? So if this person doesn't know what to expect, but you also need to let the person experiencing this know, let's make it about the ultimate goal and drive the behavior from that, direction, right? And so inviting a third party in to sit in and to help manage that conversation. So once HR or whoever else can say, I'm here to support the both of you, but acknowledging this is going to be a difficult conversation. We don't need to sugarcoat it and stuff like that. I mean, I've had conversations where I'm terminating an employee or giving corrective action, and I have to say, this is not where we want to be, but we have to be here today to have this conversation due to whatever else. And then I would start off with the individual who feels like these behaviors, and I always advise that you have some specific examples are always great, because sometimes people, if you ask people to think generally about where they may have exhibited these behaviors, first of all, they don't see the behaviors, right? So asking them to think about those situations is pointless, because they're not going to be able to pinpoint, because they'll sit there and be like, no, everything's good. I don't know of any time that I may have offended you or whatever else. And I think it's being factual and succinctly and saying, hey, there are 3 examples that I want to review with you. And these examples are this. When you made this comment to me, like I've had a leader say, I prefer your hair when it's straight. And I looked at him, I said, oh, do you? And she had the nerve to repeat it. I said, if I say, oh, do you? You should say, no, actually, I don't. I lied, and stuff. But she was like, yes, I actually do. I said, well, my hair is not naturally straight, so you're preferring something that wouldn't ever naturally be possible. And she was like, well, yeah, but I'm just telling you, I like it straight. I was like, all right, let's take a break, but I really would like to circle back with you about how that comment made me feel. And just left it at that. And she was like, oh, great. So I think having some specific examples to talk about, this is what you stated, this is how it made me feel, this is how I would prefer that you address this situation. Because sometimes it's addressing a situation or talking about something with a microaggression like thrown in there, right? And stuff. So I think it's being clear of, this is the situation, this is what you said, this is how I feel, this is how I would like you to address this in the future, or this is what I would not like you to say in the future. So I think being very clear about that, if that helps. So I think number 1, finding a neutral third party if that relationship is not one where you can just have that dialogue together. In my example with that leader, I knew we could sit down and have an outright conversation, and that they would be understanding of it. And the key with these conversations too is not getting to a point of agreement. I want people to get rid of that. Like, it's not about agreement, it's about understanding. Like, I am not here for you to agree with me that you shouldn't, say that my hair is straight. But once you understand, you don't repeat the behavior, right? But if you just agree with me in the moment without understanding, it's a pacifying kind of thing. So if all I'm seeking is agreement in these conversations, that's never going to get anywhere. You're going to have people say, oh, I'm sorry, you're right, and do the same thing the next time. How many of you have experienced that? Just in different situations, right? Like where it's like, oh yeah, you're right, and they do it again, because they're agreeing versus understanding. So ultimately, that's what you want to get out of that conversation is, again, number 1, third party. Number 2, having some specific examples and not leaving it up to the person to think of the times that they disagreed with you. And number 3, making sure that there's clear understanding versus agreement.
That was really good. Thank you.
You're welcome. I like the questions, Buor. You have great questions. Maybe let me ask a question as well as you think about more. What concerns do you have? So as a healthcare provider practitioner, in your different spaces, what concerns do you have about being inclusive in healthcare or making healthcare inclusive? Like, what is your biggest kind of angst about it as you either start or continue your careers?
I think, like, as someone who's, I'm sorry, Sarah, as someone who's just kind of entering, like, I've worked in healthcare for the past year, but I'm really just entering as a nurse in a couple of months. I feel like it's a little overwhelming just to have started to realize not only like the inherent racism of healthcare, but just that the structure of it is not really built to serve people. It's like built for money. And so that is just, that feels very overwhelming right now. Like, I feel like kind of what Omera was asking about, like, how do you enact change when you're just like one person in this massive system? And that's what I'm grappling with.
Yeah, and it is like, it is overwhelming. You know, I will say honestly, being in it, having been in healthcare HR for about 10 years now, and now being part of this huge organization, you know, which you love and you hate at the same time. You know, you're like, yes, we have 184 hospitals. How are we ensuring healthcare equity, you know, in each one of them? But even being one person, I think it's being encouraged that you will always find one other person, right? So it's, I'm one person, but you find one other person, then you find one other person, and you find one other person, and stuff. So you can create change that way. But also just know that having the thought and the active interest and being in the workplace is already creating change. Because then what happens is when you have that patient that, let's say, is transgender, and you have a provider or somebody that refuses to use the right pronouns or whatever else, it's speaking up. Like, that makes a difference in that moment. So I think it's being mindful that you can drive change, you know, from whatever position that you're in. So it's saying, you know, and I'll pick on the docs, you know, it's saying like, hey doc, actually this is the pronoun that needs to be used for my patient. It's not letting your patient battle that themselves. You're there to be their advocate as well. So I think it's keeping that at the forefront, and you'll be surprised that as you do that, people listen, people learn, and people change, you know. So it's, please do not think that one person cannot create it. You continue with that, and you continue educating others and making sure your voice is heard. Another thing, you know, with this, as you look to create change is, it comes back to, I think communication hurts people sometimes. You know, I think, again, with two siblings in healthcare, and this is a loaded statement. You know, I get pushback from some people about this because it means that we're being more mindful of others than they're being mindful. But it's being strategic on how your voice is heard. You know, healthcare is hard, and I think if you want to drive change, sometimes the feedback you give and the way you lean in needs to be constructive. I have friends in healthcare who are very passionate about things and express that day in and day out, to the point where they call their institution stupid, and they call their manager stupid, and they're like, they don't know anything about this and they need to learn and whatever else. And I'm like, but sometimes you do that to the point where it becomes white noise, right? And then you're ineffective, you know, in trying to drive change. So that's why I said it's a loaded statement, because a lot of people disagree. But having the seat where I am, I think has taken some strategic communication and strategic actions to get to this point where now, as far as the executive team, I can be outspoken, because guess what? Now you have to listen, you know, and stuff. So I always tell people, as you get into healthcare, be strategic about your communication and about driving change. And not all of you may want to become executives, but even as you're a charge nurse on a unit, you know, you are now influencing others. And leading them that way as the voice of reason, as the person who gives constructive criticism to leadership. you now become the go-to. You know, you will find others coming to you and saying, what do you think about this? Whatever else. So again, loaded because sometimes people think that's like dancing around it a little bit. But to me, the work of DEI is truly strategic. And we have to make sure that people are equipped in that manner to drive change. Because I did have some moments where I'm like, nothing's ever going to change when I was a recruiter, when I was an HR generalist, when I was an HR business partner, you know, but little by little, I would plant nuggets. I started to have access to the CEOs, and I put myself on our division committees, and leading some of the DEI work at our facility now and in our division, you know, so getting there where now when we're in a meeting and our division CEO says, hey, Tonzia, tell me about this. First of all, I'm still like, wait, Sylvia, you're talking to me? Like, oh, that's nice. Like, hey, you know, I'm still that person. But now I know that my voice matters and I can drive change from there. So it's not always easy, but I just encourage you that even being one, you can drive change. You know, so don't ever feel that you're not, but continue to be influential, build relationships. Being relational helps drive that change that is needed as well. So. Oh, thanks, girl. I love the emojis.
Okay, I have one thing that I think building off of that, though I think that really encompassed a lot in what you just said, so I appreciate it very much. I think it's something that we're all aware of, but sometimes we forget the importance of actually taking those actions and the reality of how much we can do as one person. But something that comes to mind for me, having worked as a nurse in several hospitals, is I think not that there's necessarily a lack of inclusion, though I think that's definitely an issue, but the lack of diversity I see in the healthcare workforce, which statistically has shown that it's not there. That I think it's less than 15% are represented by minorities. And that's just minority groups, never mind considering like our LGBT communities and Native Indigenous communities as well, that I don't think are encompassed in that as much. And so I guess something, especially within this group, something that's important for us is being able to represent and advocate and have that inclusivity and equity involved. So I guess what can we do as students in terms of or just as individuals to, I guess, continue to advocate and to embrace more of that diversity in the workforce and gather more people who come from more marginalized and underserved groups in the workforce to be represented, because our patient populations, they're not represented. And having been a nurse where it's majority white providers, I can be an ally all day, but it's not the same thing as having somebody who is a native Spanish speaker or looks like you or talks like you. And just kind of any thoughts that you have on that in terms of things that we can do, I guess, potentially like as students or just as healthcare professionals in general to continue to try to advocate for that happen.
Yeah. So I think first as students, I think just even getting on a call like this or being part of an organization that is focused on this important issue is key, right? But I think it's also holding your institution accountable to ensuring that they have programs that help or drive diversity to the school, right? So are they going out to different schools? Like, will you get an opportunity to go to a majority minority high school or something like that to talk about being in the nursing program or the nurse practitioner program or whatever else? So it's inserting yourself in all those different spaces to be the space, because that's how you recruit students of color, you know? But not just recruitment, but challenging your institution on how to retain as well. Because if you recruit, but there's no inclusion occurring, that's how you have turnover and have folks leave and so on. So I think as students is asking those hard questions and saying, hey, we have a recruitment team and there is our student recruitment groups. How can we be part of that? So we make sure that we do voice, like, where are the students of color? What high schools are we going to that we're recruiting from? What areas are we recruiting from, right? So that's where you can influence. And then coming into the workforce, one of the things that we require at my facility is peer panel interviewing. So we require that there be a group of staff members that interview every individual. And that's where you can influence. So as you join a company, it's saying, what are your recruitment practices? How can I make sure I'm on that panel so that if you do interview, you know, someone who fits in any of those categories that you're looking for, and I'll just use the term minority, right? If you do interview a minority and someone says, you know, and this is one of the things that HR, that I'm a stickler for, is when a person of color is interviewed and the majority white panel says, I don't know if there'll be a cultural fit, you know, and I say, okay, let's talk about that. You know, because cultural fit should not be used as they're not like me, because we should be talking about how do they meet the mission, the values, the standards of the organization, and are they going to put patients at the forefront, right? But cultural fit nowadays has been used as they don't look like me, they don't talk like me, so therefore they're not going to fit in and stuff. So it's making sure that as you join a workforce, insert yourself in those processes and say, hey, let me job shadow this person around. Let me be part of this panel. So you can influence and say, hey, team, help me understand that. Like, you know, Susie just said cultural fit. Like, tell me about that. I feel like she met our values or he met our values or whatever else and is excited about our patient population. Let's talk more about that, you know, kind of thing. So I think it's really, again, inserting yourself in those spaces where you start to influence those decisions. And as wherever you work is asking the question, like, hey, we have an entire unit with one male, you know, on the unit. What are we doing to get more males into this space or whatever else? So all of that is unfortunately more work for you because you're like, I want to go to work and I want to go home. But, you know, when you're trying to drive change, some of this is needed, right? That additional work outside of, you know, our clock in, clock out time to ensure that you are part of the solution and driving change.
Thank you so much for your time and all the knowledge that you shared with us. This has been really enlightening and encouraging to know that someone in leadership shares a lot of the same beliefs that we do and inspires us to continue pushing on with the work. Even if it's hard, it's possible. And bit by bit, we can all be agents of change. So thank you for sharing your time with us and your insight. We really appreciate it.
Yes, you are very welcome. Thank you for having me. I want to make sure, Sawa, if you could share my contact information with the group, that'd be great. So if you think of any questions or just want to have conversations, I have friends in healthcare who call me from everywhere and say, I'm dealing with this situation. Can you just talk through it with me? I'm more than happy to. And of course, I have to plug for North Suburban, all you new nurses. I need y'all to drive up to Staunton. I got sign-on bonuses for you, and I will get you in and working in a day. So, yeah, so give me a call, get my contact information, whatever you need. Again, if you just want to just chat, sometimes that's what's needed. Please know I'm here, and I want to just make sure, again, that healthcare is hard work, and it takes a lot out of us, and sometimes we just need someone to call and just say, I hate my manager, but I know you're going to help me understand how I can better communicate with them and stuff, and I can help you do that. So, yes, come work at North Sub and let me know if you need anything at all. I'm always available. Thank you all.